So on dentistry, we would reform the NHS contract, which has been failing, and it's been known to be failing for over a decade. As dentistry has become more complicated and people's demands have become more sophisticated in terms of dentistry, dentists haven't been able to cover their costs with the money they've been paid per patient by the NHS, and it's just become a downward spiral, and dentists have not been able to pay their bills if they're working for the NHS, which is absolute nonsense. So if we believe in an NHS dentistry service, we have to fund it. In terms of the NHS, part of our programme is to reform social care so that we have a system which is sort of holistic. So the pressure on beds, for example, in hospitals is relieved because we have proper care in the community for people who shouldn't be in hospital, who need to be out of hospital being cared for either at home or in step-down beds, intermediary beds, or by carers. So we have a whole plan for the carer workforce. And GPs, we need more GPs. We're losing GPs very, very fast. And that's all about the pressure on the workforce. So I spent a long time with a local GP recently who was saying that there are 3 times as many people looking for GP appointments now than before the pandemic. And they don't really know why, but it's just the pandemic has really shifted people's relationship to health. So the GPs that are there are working much, much, much harder, and they're getting burnt out. So it's not just about training more all the time. I mean, the government talks a lot about training and recruiting, and obviously that is part of our plan, but we are very much in the mindset that we need to retain the people we've got in the workforce, the people who've got the experience, the people who know what they're doing. If you lose a midwife with 20 years experience and you get a newly qualified student midwife on the ward, it's a very different thing. So we need to sit down with those people in all those different areas and listen to what they need. I think the fact that the government has not got in the room with the junior doctors, for example, is absolutely appalling, because how are we ever going to resolve the dispute over pay if they don't actually sit down and talk to them? And then just lastly, we've got a whole raft of policies on public health, because we believe that there's no point always trying to fix the NHS without looking at the pressures that are on it in the first place. And that's all about health and well-being in the general population. It's about food, it's about exercise, it's about obesity, it's about alcoholism, it's about mental health. I mean, my previous job at Devon Rape Crisis, I was very involved with the mental health services in Devon, and they're on their knees. They basically don't exist. So there are thousands of young people who are struggling, who, if they had a little bit of support early on, they would probably not go on to develop lifelong problems. But because we have decimated those support services, things are getting much worse, and then it requires much longer and more expensive treatment. So we have to start at the beginning, and that's a generational change, but that needs to happen.